Welcome to Public Health Minute, a service of the Nebraska Department of Health and Human Services. Hi, I'm Allan Urlis in the Office of Communications. In this segment, we're talking about seasonal affective disorder with Dr. Tom Janousek. Dr. Janousek is the Deputy Director of Behavioral Health at DHHS. Doctor, thank you very much for joining us. Seasonal affective disorder. What are the symptoms? How can you tell if you have it?
Sure. So seasonal affective disorder is kind of a seasonal onset depression, and it's most often occurring with during the fall or winter. So what we typically see is we see some folks that have maybe a depressed mood, or we see some lack of energy, different sleeping patterns, sometimes increased irritability, and it typically occurs in the winter and often resolves in like the spring or the summer.
So how can you tell if you have it?
So what we typically see are instances where people have that decreased mood. Maybe they are feeling a little bit more agitated. Maybe they've known or noticed that they're having a little bit different sleep pattern. But one thing that's important to note is that many folks have lower energy and different changes in activity during the winter months. I mean, it just comes naturally. We're hunkering down more with the winter. We're not going outside as much. We're maybe not doing a ton of things that we used to do. And so it's important to distinguish just that kind of natural change in activity versus what might actually be a clinical problem. So where it kind of gets into that range is where you notice maybe you're not doing things that you used to like to do in the winter. So for example, maybe you loved your family gatherings, or maybe you had a tradition that you loved to do. You don't really seem to have the drive to do that anymore. You're feeling more irritable about it, or you're feeling as if you just don't want to do it in general. When that kind of happens, that's going a little bit beyond what would be kind of normal changes with weather, and it's really getting into that where it might be a major impact to your mood.
What is there to do to combat it?
Okay. So what we typically advise is that you kind of combat it with what one would do with regular depression symptoms. So it might be trying to increase your physical activity when you're at home. It might be trying to get on a more regular sleep schedule. It might be trying to seek more social support from your friends and family. But what's important to note is when you just kind of need to acknowledge that time where maybe you need to see a mental health professional, because they may be able to help you with something like antidepressants or even light therapy, which can kind of replace that missing light that we typically have during the winter months.
What do you say to skeptics who think seasonal affective disorder, maybe it's just not a thing? Mm-hmm. What do you say to them?
Well, it's important to note the winter blues are extremely common. And like I said, mood changes with the winter. But for those that may be skeptical, the question is to ask, maybe you're missing something that could be a longer standing depression episode, and you're just kind of writing it off because of a seasonal occurrence. So it's important to make sure we're really assisting our friends and family where we notice there may be a major change in mood or activity, and making sure they're getting referred to the help that they need.
And that's when you should seek out a professional, a therapist.
Absolutely, yep.
Okay, very good. Anything else you want to add?
One other thing that we just want to recommend is if you notice your friends or family needing a little bit additional help, one other resource we have in addition to reaching out to a mental health therapist is using our 988 Suicide Crisis Line. The 988 line, it's a free resource that we allow for people in times of crisis. You can just dial 988 and you'll get hooked up with a counselor to come and talk with you, chat with you, and assist you with getting the help that you need.
Very good. Thank you for being with us and sharing important information. And again, thank you very much.
Yeah, it's great. Thank you.
If you or a loved one needs help, the following resources are available. Thank you for watching this segment of Public Health Minute.